Welcome, Dr. Siddhartha GHOSH. She'll talk about the journey of it's a refractive IOL has changed its look.
Thank you, Dr. Arup Bhomik, for including me in this course. And I'm going to talk about refractive IOLs has changed their look, coming with big solution. Well, we all know that in the ever evolving field of ophthalmology, the pursuit for visual perfection and patient satisfaction drives constant innovation. And that is how we have seen the evolution from monofocal IOLs to monofocal with EDOF properties, and then pure EDOF lenses, and then hybrid EDOF multifocal lenses, and then the trifocal lenses. So it is interesting that there has been a great evolution, and we have just heard from Dr. Arup Bhomik about the EDOF lenses. Well, what I am going to talk, there will be some overlap, although, but what I am going to talk about are the purely refractive lenses and how they are going to change the scenario in the future. This is one lens which is purely a refractive lens, and this is the light adjustable lens. And this is actually a multi piece or a 3-piece monofocal IOL which is made of silicon and filled with macromers. These macromers are photosensitive material which can change the shape of the lens when irradiated with ultraviolet light. Well, how does it happen? It is interesting to understand that this particular lens, when it is implanted in the eye, and then whatever residual refractive error remains can be corrected within the eye. The lens is inside the eye, and you can correct the shape of the lens, wherein you can change the dioptric power of the lens. So that is really interesting. After a few days, when healing is relatively good, we do a refraction, and once the refractive gap is ascertained, you can irradiate the lens. Say this is how it is done. The UV rays are this lens is treated with UV rays. There is polymerization of the macromers, and the shape of the lens changes. Once the desired refraction is achieved, we can lock in with further irradiation of the whole lens, so that no further changes would happen, and that gives us the final result. So for hyperopic changes, you have to make if you want to add plus power, you have to irradiate the central part with UV rays, and to change to have myopic powers, you have to irradiate the periphery. So this is how it is being done. And interestingly, this is available as LAL light adjustable lenses, LAL and LAL plus. There are two varieties. LAL plus is EDOF lens, and all these varieties are also available as toric versions. So now, as for the indications, most patients are suitable for these lenses. But to my mind, what I feel, the patients with a previous history of refractive cataracts, refractive surgeries, wherein there is a higher risk of refractive surprises that we get from our standard biometries and formulae, those gap can be corrected with this lens. They are the most suitable patients because we can change the power of the lens after implantation. So this is one, but there are some contraindications as well. These lenses are not good for patients with nystagmus or a severe corneal scar, or who had a previous history of herpes keratitis. Well, next I'll come to the IC8 from Athera. This is a small aperture lens, and as you can see, there is a dark annular ring, and this dark annular ring will block the paraxial rays, and this small aperture technology actually allows only the central light rays to focus on the retina, providing a EDOF effect. Well, this we have already heard about SIFI well ready, and this is where the spherical aberrations, the opposite spherical aberrations in each annular. There are three zones, and each one has an opposite spherical aberration, and that is how EDOF profile is achieved. This one we are very used to. We have been using for quite some time. This is the VVT lens and from Alcon, and what it does is it actually stretches and shifts the wavefront, and that is how EDOF profile is attained. And as you can see, there is a 1 micron elevation, there is a surface elevation, there are no rings, and there is another surface transition zone in the center. So this will stretch and shift the wave front. You will see now how it does. So the emerging rays are going like this, and from this is the stretching that starts from the elevation central elements, and it just stretches it or delays it, delays the wavefront and shifts in front, so that most of the light is being used for the EDOF effect. And of course, the Lucidis lens, this is another new type of refractive EDOF hybrid lens, where the central aspheric element is surrounded by a outer refractive ring. Well, IHANS, we all know, we have been using for quite some time. The difference in anterior surface is visually not detectable, but the center of the lens, there is increased thickness and there is an increased curvature there. And a similar technology is done on the posterior surface of PRC lens to attain the EDOF effect. I need to mention the Envista because this is a optic which is aberration free, and the basic concept here is to use the corneal aberration which provides for an added depth of focus. So these lenses are more forgiving because even slight decentration won't matter. Well, this is another newer generation refractive EDOF lens. This is from Apasami, and Suprafo in focus, which is a bifocal refractive lens with an EDOF profile, and it is not people dependent, because what it does is, the light rays that pass through the 0.3 micron below the edge of the central zone, it bends inwards, which eliminates light scatter, and thereby you attain a good EDOF effect. And this is the new kid on the block, the spiral optics from Renner Galaxy. We don't have all the information for this lens, but it is a full vision lens, and there is very minimal dysphotopsia. There are no diffractive spiral optics, so there is no loss of light as such, and these are also available as torics. This gives good near vision, and the best part is the surface do not have any discontinuities, no steps or any annular rings. This has a smooth optics. In want of time, this discussion can go on, but I think I'll end here. Thank you.
Thank you, Siddhartha. It's a really tricky and very, very difficult to understand the optics of the all lenses.